Hi, I'm Dr. Kelvin Koh, a gastroenterologist with the gastroenterology group.
I'm physician Negoro. I'm from Thomson TCM.
I think the food as medicine is a very interesting concept because it is something that we are increasingly realizing in Western medicine. We used to take this two parts, so we used to have patients that we give medicines, and then food never really used to be part of our prescription, so to speak. But increasingly, we are realizing that there's a central role that diet plays, and especially a varied and balanced diet plays in the gut health, particularly the gut microbiome. And therefore, paying attention to the food that we eat is almost equally as important as some of the medicines that we prescribe. What do you think?
We can't just base everything on medication alone, because when we see the doctor, it's just one time, and then the follow-up is maybe 1 week or 2 weeks later. And after that, after leaving the consultation room, we are actually on our own and we eat 3 meals a day. So it's very important that we really emphasize on what we put into our body. So in TCM, food as medicine is also one of the main principles that we really emphasize. So in TCM, the gut is actually made up of the spleen and the stomach. So the spleen and stomach is the main 2 organs that actually absorb the nutrients from the food, the drinks that we take in to produce the qi, the vital energy, and the blood. So if your spleen and stomach is weak, then you produce less qi and blood, which will make you feel very tired, sluggish, affects your mood also. And also for women, it can also even affect their menstrual cycle. So definitely food plays a very important role on TCM also.
I like that idea of the body being interconnected, because that's something we are also starting to learn from TCM. In the old days, we used to be very reductionist, so each of us focus on one organ or one organ system. But increasingly, we are realizing that, for example, the gut and the brain have a vital axis, and so therefore mood problems will manifest as gut symptoms, and vice versa. In other words, someone who has insomnia may present with worsening reflux. And so things like that actually make us realize that we have to treat the patient not just as individual organs or symptoms, but to look at them as a whole. And that's something that TCM has right from the very beginning.
Yeah, because like in TCM also, although we do say it's the spleen and the stomach, the liver, which helps with the smooth flow of energy. So if there's a lot of stress involved, your gut is affected also. And I think from the Western perspective, there's a lot of intercorrelation with cortisol level and sleep, and also your appetite and how well you digest your food.